Welcome to the Rebel Matriarch Podcast. My name is Samantha Sanford and I am your host, and I want to invite you into this session with an open heart and an open mind, because this is not just a podcast. It is a global movement, a global uprising, and this is a representation of what is truly possible and available to women today. Hello, gorgeous human beings, and welcome to the Rebel Matriarch Podcast. My name is Samantha Sanford, and I am your host. And I am bringing to you today an extraordinary woman who is a wealth of knowledge, experience, and magic. Truly. We've just been having a pre-conversation, and she's sharing all these aspects of who she is and what she does. And I'm just like, whoo, okay, we got to get this on the call. We got to get this on the call, because I know that so many women are going to benefit from this conversation, because you can't mess with experience. Like you cannot deny that the volume of experience and wisdom that's going to come through in this conversation. And I really want to encourage women to sit with the information and actually consider applying the information to themselves, because your life will change. And I don't even know Joan's full story, but I know that your life will change if you really listen to this wise woman with an open heart and an open mind. And so I am really honored to introduce to you Dr. Joan, who is very much about reconnecting women with their personal power, reconnecting women with all that they're here to be, through understanding the depth of their body and how they actually function as a human and spirit. So, Dr. Joan, thank you so much for being here on the podcast.
Well, thank you so much, Samantha, for inviting me on. It's my pleasure to share. And, I choke up sometimes because I wish that I had been able to tell the young self of me what I know now. And so I just had my 75th birthday. And I am so lit up about my life that I just said to my daughter-in-law, I said, I am literally having the best time in my life now. I'm having the best sex. I'm having the best personal life. I'm having the most fun creating this new experience in the online space over the last handful of years. And my background is that I've been a conventional Western medical doc, holistic dentist. I had a holistic health center in Midtown Manhattan for about 30 years. And I also, at the same time, did bioenergetic healing because I sent myself to acupuncture school. I have a master's in acupuncture. I do craniosacral work. I've been studying with a Taoist mentor who's like the Dalai Lama of Chinese medicine. He teaches all over the world. And so I've really integrated shamanic healing. I'm a psychic. I do intuitive healing. And all of this combined is to say that, last year, life is such a progression. Life is it's such a beautiful experience if we take the pressure off of ourselves and say, last year I came out on I was it was kind of a testimonial. And I said I was having the best fuck yes life because as I was going through all my growth and development, I mean, there was a lot of crap I went through. I had everything. I mean, and at this point, I really can look at everything, and I live by two pillars. One, it's not my business, because things used to bug me all the time. This person said this family member, blah, blah, all of the things that we all have. And I just learned to it's not even letting it go. I just don't go there. I just choose a different frequency. I choose a different frequency constantly. And I never understood that we could do that we didn't have to be at the mercy of our experiences. in each moment we could say, oh, what gives me pleasure now? Under the guise of love and kindness and all of that. But it's not about forcing life. It's not about a something under duress. It's not even doing the work now. If I feel that I'm tired, I rest. I always incorporate some personal practices into my day. And that's what I share with clients when I work with them, because I have an overflowing toolbox from all of the years that I've, whether it's of different frequency medicine. I'm not practicing conventional medicine any longer because my focus is really sharing with people how to choose their frequency at will. It, I'm always reminded, and I always see this in my head. Years ago, I was a very big basketball fan, and here in New York, the Knicks years ago were a great team. I don't even know what's going on with them now. I don't really follow it. I had the extraordinary opportunity of seeing some of the greats really in the Madison Square Garden here where they played. And I remember seeing Michael Jordan moving down the court, full court, and doing a dunk. And it was as though he was, they talk about Air Jordan. Well, he was in the air. That's why they talked about that, because and we can do that for ourselves. We can have our life like that. And I remember for years, my, the mentor I work with in Taoist philosophy and medicine would say, well, it's a choice. And I'd look at him and I'd like be pulling my hair out going, yes, but blah, 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 and this, and I had this. And he'd look at me and he'd smile. And then, I don't know, after a while, I said, oh, I can choose how I want to feel. Oh, and sometimes when I work with clients, or I mentioned to you, Samantha, that I have a book coming out in about a month and a half or 2 months. And sometimes I sit there and I think, doesn't everybody know this? It's so obvious. And then I go, yeah, I usually say that to my partner, and he'll look at me and go, no. And then I remember that I didn't know it, even though it's very simple and it's easy to change and shift. It's this idea of choice, this idea that what is going on around us and inside of us, we have agency over. We are sovereign beings. And I think knowing that, and that's why I said, I'm living my best fuck yes life, because I just really choose not to let the little niggly things bother me. We have this one incarnation in this experience. I don't know what happens after. Nobody really knows. And whatever you believe is fine. But we have this time, and it's not that long. And when I get into because I'm human like everybody else, I go through grief, I go through this, I go through that. The difference now for me is that it's very short. And I see one of the pieces in the book that I have is time is a flower. And that's because it's not linear. And we know that because we know our history, we dream about the future. And so we're always, I think Melanie Ann Lair talks about atemporal coherence, which was such a wonderful concept she brought forward, because it's showing that, yes, when we think of the past, when we think of the future, when we think of the present, this is all like in the moment. And we have this great ability to weave our life like some amazing fabric. And I never think, oh, I shouldn't have done that. I shouldn't have had that in my life. This terrible thing that happened to me. Oh, woe is. No, I never think of that. I think, oh, thank goodness for all my experiences. And some of them have been pretty hairy, because I wouldn't be where I am today without them. And I love where I am.
I love this. I love this. And so people understand where you're at now. Where are you at now? What is it that you're passionate about now? You've got so much life experience and it's so diverse. And you're at this point where you're having the most amazing fuck yes life. What is it that is so important now, knowing what you know?
Well, I have this, it's really funny to say this. About 4.5, 5 years ago, I was doing acupuncture and, never really came out until fairly recently about my extra abilities. And it's not, I think we all have that possibility. It's just that for me, it's always been interesting. And I've noticed them since I was a small child. At the beginning, I hid them because no one talked about the fact that you could, adjust time, make it longer, shorter, and all of those things. And that sometimes I saw things but nobody I knew talked about it. So I kind of hid those things. And right now, I would say what is of interest to me is how to help convey the idea that we have the ability to help children and ourselves. However, I think of it as children because if whatever we're doing for ourselves is like, it's kind of, I won't say it's fixing, but it's after the fact. What if children never had to have a lot of the crap that we have all gone through? And I believe without a doubt that something as simple as the swallow and the position of our bodies in space can make that change. And so I mentioned to you, Samantha, that I am trademarked changing global health one swallow at a time because I learned, yeah, as a dentist, I saw so many people with head and neck pains, migraines, back pains, leg pains, joint pain. I mean, the gamut of problems. And a simple tweak like creating the position of yourself, and I use the position of in Taoist philosophy and medicine, one of the, just like yoga, Tai Chi, martial arts, Qigong is something like that. It uses the breath and it uses postural movements. And if you put yourself in that, and I'll do it with everybody right now. Why wait? Let's do it right now.
I
So
love it.
imagine your head going up to the sky, the heavens. Imagine your feet, even if you're sitting down like I am, planted deep into the earth core. And imagine your tailbone tucked under a little bit. Do it like a pelvic tilt slightly. Suck in your gut a little, but not holding too much. Check your shoulders. Sometimes, raise them and drop them. Check where is your head in space. Is it forward, back? People have injuries. We go through life and there are lots of lumps and bumps, and maybe the head is like this from a shoulder issue or that. So we work on those things there are many things we can do. And then if you place the tip of your tongue slightly in back of your upper front teeth, not touching the front teeth, and creating that posture of the tongue as an upright position, bringing your lips just gently together and your teeth a breath apart over at the beginning, if this is not how your body commonly goes, it will feel awkward. It will feel like a strain. However, if you practice this over time, and the easiest way to do it is how I did it for myself. Whatever I was doing in life, you know how you check in with yourself, like, how am I feeling? What am I doing? The little things. Check in with yourself. And if you're not in that posture, bring your tongue back to the spot, adjust the rest of your posture. And over time, because it is the place of least resistance for our organ systems to function, for our bones to be aligned, and our tongue to swallow and create you won't get jaw pain doing that. People who have sleep apnea, this is like how you change that. People don't realize that the tongue is a muscle. I think there are only two muscles that have one attachment only, the penis and the tongue. And the tongue is not used to, for most people, being in the upright position because most people have a tongue thrust. The tongue hangs out in the front or it's moving, and you can, once you start to feel it and see it, but what that posture and tongue position does is it trains your tongue. Like if you were going to the gym and working out a bicep, that's what you do. So because if the tongue is not used to being in that position, it's going to feel weird. It's going to feel like an effort to keep it up. However, if you strengthen that muscle of the tongue to be in the upright position, then when you swallow, if you imagine that these are your upper front teeth, and if you put the tongue here, and most people will collapse in the middle and thrust forward. And what does that do? First of all, from the teeth and the gum part, it really puts a lot of pressure on the bone in the gums. But the worst part is it thrusts the neck forward. It impairs digestion. It creates all of our senses because we don't realize that we are these huge antennas, and all of our senses, besides our skin, really, and the openings, the anus and the genital area, everything is in our head. Our eyes, our ears, our nose, our mouths, all of these things bring information into our being. And if we're not in a structured way to receive it in the most harmonious, auspicious way, well, we're shit out of luck. We're not going to get the full flavor of our life. And so that's really why I'm so passionate about all of this. And I really believe that as we share this information with our kids, with our families, with our loved ones, our business people, because what will this create? More function for everyone, less suffering. And when there's more comfort and less suffering, people feel better, they get along better, and the world works better. And that's really my reason. And that's why a handful of years ago, I said, I could go into it a little after, I went through some pretty challenging times medically and physically myself. And so I really wanted to have full function again. And I learned how to do that with many different things. And that's really, and I wanted the children in my family to know what I had done. So I said, okay, this was kind of crazy. It was like out of the blue, although nothing is out of the blue. I just had this, it was like the universe was kicking my butt. You have to do this. You have to do this. And I remember saying to some of my besties, I'm very private, that when I worked at my holistic health center, it was all word of mouth referral and fee for service. And people came because they saw what was happening in the center. And I never really, when one-on-one, I would talk to my clients about myself, but I never went out there and said, this is what's happening, this is what I've been through, and this is what I'm sharing. And I said to my friends, I said, I'm very private. I don't really want everybody knowing my business. And they said to me, well, what do you think, Joan? This, if you're going to do this, it's going to happen. And I said, and so I was kind of hesitant. And for the first couple of years, I didn't really speak much, or I really didn't say that much. And then I just said, well, if I'm going to do this, I really have to get over myself and just do it. And so now I'm a real open book. What you see on the outside is what's on the inside. There's nothing hidden. I had a near-death experience. I was run over by a taxi. My ankle had to be rebuilt. It was totally crushed. I had to teach myself how to walk over 3 years, 3 times, learned how to create gait again. I had an eye tumor that was cancer. I had to deal with that. And so I learned how to recreate midline. In fact, one of my most recent clients is a physician's assistant in my, and I get followed all the time with an ophthalmology oncologist who now it's like a love fest when I go in there. But it used to be like, because I waited way longer than they wanted me to do the conventional treatment, because I knew that if I didn't know the foundational reason why this occurred, it would come back in some other way, because I understand that about medicine and about our bodies. If there's a patterning going on in our bodies that is creating certain symptoms, and what are symptoms? Symptoms are our teachers. They're like the best thing for us. They go, pay attention here, because without them, we wouldn't know. And so, and then what else? I had something, oh, my, it's not an aside. The love of my life, my husband passed. I had terrible grief. And so all of these things, instead of burying me, although for a period of time I was digging myself out. But what it did was it said, what do I really want? I have life left. How do I want to live it? And that was when I said, fuck yes.
After all that, that was when we said fuck yes. Okay. Oh, wow. I have so many questions and I love this conversation. I'm going to steer towards the symptoms aspect because we're living in a world where we're taught and conditioned and trained. As soon as you get a symptom, go and see the doctor. Okay. And we're going to prescribe you with something to address the symptom. And I have contention with the medical industry because I don't feel like it's a health industry. I feel like it's a pharmaceutical industry. And I know that pharmaceuticals serve a purpose, but I feel like they've been over abused. And I feel like people have been trained to overlook what the symptom is telling them and to dig deeper. And they just naturally go and to whichever medical professional say, these are my symptoms. What can I take? Or what's wrong? What's that? What's the immediate thing that's wrong? But no one ever actually deep dives into why is this a symptom? Why is it coming up now? What else is in play? What's the underlying cause? And so I feel like this is why there's such a huge pandemic in the state of health globally. And so when you were talking about you received various diagnoses, especially with your eyes, and you were refusing to do the treatment straight away because you wanted to understand the underlying cause, I just wanted to sort of discuss more about that. I'll go a little bit deeper with that because I feel like so many women need to understand the importance of this conversation because so many women are busy and we're doing all the things and we're getting a symptoms and we're just popping pills to disguise the symptoms so we can keep going. And I feel like what you're saying is too important to miss in that we need to slow down and actually start paying attention and ask different questions as to why something's happening.
I totally see that. One thing I do want to say though is I am not anti-conventional Western medicine. I use conventional Western medicine. I do all of the things. However, I do it consciously. Here's an easy example that just happened maybe 2 weeks ago. In New York, we had a very big snowstorm, and New York City hasn't had a foot of snow in a really long time. And I walk almost every day. Today I walked probably six. I walk anywhere. It depends on how much time I have at the end of the day, but I can walk up to 10, 11 miles, and I have no hardware left in my ankle. I have nothing left. It's all because I didn't want to. Um, the surgeon was amazing, and I remember when this happened to me, and I went to a number of different surgeons to get opinions, which in and of itself was kind of wild because I had to go on a stretcher because I had no ankle. And the concern was that if they couldn't rebuild the ankle, well, I wouldn't have a foot, which is really scary. And so I I had that done. And so I'm very happy that I am so functional. And so on the snowstorm day, while it's still snowing, and I walk in the park almost every day because living in New York City, it's so nice to have nature. And I live really close to Central Park, which is a beautiful area. And so I went for a walk during the snow and nothing was plowed. It was really, everything was a lot of efforting because you had to really lift. I had good boots, but still. And so I'm walking in the park and it was like a festival. There were so many people there. People were sledding, they were, walking, and there was a huge amount of snow coming down. And there was a little, not a regular snow plow, but like a park-sized snow plow coming at me as I'm walking in the opposite direction and beeping on its horn, beep, beep, beep. And I'm talking to a close friend of mine on the phone. And I said, yeah, I don't know why. He can move over. There's room there. And she goes, well, I think you better get out of the way. I even hear it. It's loud. And I looked and I said, you know what? I think I'm going to have to jump in this snowdrift here on my right. And so I did. And she said to me, can you get up? Because she has structural issues. And I said, yeah, I guess so. I popped up and I kept walking. And then after a while, I decided I was going to go home, and I'm going across Fifth Avenue in New York, and nothing. The road is totally filled with snow. And there were quite a few people crossing. And it was like I slid into home base or a home plate or something in a baseball game. I just went down and I felt it because underneath all of this powdery snow was the road, hard cement, concrete. But I didn't think much of it because I don't, I just move, I do things. I'm very athletic. And so there were so many people. I saw a young couple to the left of me, and I saw the guy. He said, you need some help? I just had put my hand up and he grabbed it and I popped right up, and I just went on my way. And by the end of that, I had walked probably about 6.5 miles and I was fine. And so I went home, and about a day and a half later, I had excruciating pain radiating from my left hip. And so, it was so painful. I couldn't get in and out of my bed. It was just like a lot of pain. I couldn't get in and out of the car. Walking wasn't bad, but changing position was excruciating. And I rarely have any pain. I called my primary care because in my mind, I like to be on the side of knowing. I like information. Then I make choices as to how I want to use that information, but I don't not get the information. And we have this amazing imaging available to us in conventional medicine. And so I didn't want to go to urgent care because even though they have good equipment, if you go to a regular imaging place, you're going to get better films or imaging. So I called my primary care, and I have one I love, and I told her what was going on, and she wrote the prescription for the imaging place I wanted to go to. I could hardly get on the table. It was like I was almost crying. It was so painful. And by the time I got the radiology report, I was almost totally better because I was doing my things. But the main thing I do that I really share with people that is so simplistic, if you get this one thing besides the tongue, which I love sharing with people, if you get this one thing from meeting me here today on Samantha's amazing podcast, know this: we can use our breath to open and manifest space in our bodies so that we have more oxygenation, more blood flow, more drainage of the things we don't need. And we can continue doing that in life. So, what did I do when I started having pain? Of course, I have frequency machines, I use herbs, I have a million tools. But the main tool I use is my breath because I go into my body, I notice the place of awareness, and you could do that right now. If you're listening here, just go in like through the top of your head. Imagine you're scanning your body. What's your first place of notice? Go there. If you don't have one, pick one. If you have more than one, choose one. It doesn't matter. Once you do that, take a nice deep breath. And on the exhale, imagine like a dustbuster, instead of sucking the air up, imagine that as you breathe out, you are blowing air into the space of awareness. And as you do that, the advanced training of it, once you get to that, because it's the practice, is to follow it as it moves. And that's what I did. I would say that was the most impactful thing I did when I slid into home base and I started having pain from that. And that, in addition to the other things I use, but without that, life really is much more challenging. So if anybody has pain anywhere, joints, back, knees, anywhere, do that. And if you're having trouble sleeping, one hand on the heart, one hand on the belly, take a nice breath in, the count of 4, hold it briefly, exhale double the amount, and over a few breaths, you will fall asleep. The breath is an amazing tool, and we always have it with us. We never need to worry, oh, did I bring this with me if I'm traveling? No, you always have it with you.
I love that. You can't forget this one.
Exactly.
How does it work, Joan? Breath, how does breath work in terms of
Well, the
supporting
reason
pain?
it works is because we are a library of all of our experiences. We don't think of it like that, but everything, how we move, our patterns are. And so, and then people don't often talk about it, although now it's much more commonly talked about. In fact, when I spoke of this to my primary care at one point, she said, yeah, we never even heard about fascia in medical school. And I don't really remember hearing about it either. But what is fascia? Now it's kind of become a little bit of a buzzword in life. But fascia is the idea that we are in a meat suit, all of our stuff that is like a rubber band. And how we move influences how this structure of fascia, which is not really structure, it's the it's really like a rubber band, how things, if you're a meat eater and you have seen chicken or turkey or something like that that's been cooked, well, you see that there are these bands holding parts of like the drumstick and the breast together. And we have those in our bodies. So if we have, and the way to change fascial patterning that's not working for you, simply doing neuroplasticity. And I did a challenge on that not long before, a few months ago. And what is that? It's like, what is your dominant hand? Do with it being safe, because never do anything that could be damaging, but simple things like, I'm right-handed, so what do I do now? As much as possible, I open my doors with my left hand. I pull a drawer out with my left hand. I, sometimes brush my teeth with my left hand, although being a dentist, I'll always make sure I do a little with my right hand because I'm very particular. And I try to eat sometimes with my non-dominant hand. I've been trying to write a little bit. These are very simple hacks that you can do. And so what does that do? That says to your body and your mind, well, what's up with that? This doesn't feel normal. And so it allows new patterns, new ways to come in because we're shifting the old. And the more we do that, see, everything is perspective. When the way to shift things that aren't working for us is to change our perspective. I'm a big art lover. I often will go to an art, if I don't feel like I'm happy or I want to be in a different mood, I'll stop into a museum. And fortunately, I'm very close to many of them. And I don't even have to go for a long time. I just have a new expression, something I haven't seen before, or new color, or a new, it could be anything. And you can do that walking in the street. So, yeah, I could go on clearly.
Yeah. Well, I think it's so important because especially fascia, and I don't know if I'm saying it correctly, but this
Yeah, you are,
oh,
Fascia.
fascia. Okay, perfect. It's something that I became aware of a few years ago, and more I'm seeing more people focus on that as a modality. And it's so fascinating because it's like putting pressure on your body in certain places, but it's also, I've seen them speak to what it is that they're releasing or what they're no longer tolerating. And it's just releasing things from the body and allowing it to function as it's meant to. Is that correct?
Well, we don't really know that. We don't know what it's meant to. I always like to and I always like to think of the path of least resistance because and why do we care if our bodies and minds are working in the path of least resistance? The reason is because we all, we're born with a certain amount of inherited life force, DNA. It's in our kidneys. And so if we're using a lot of life force because it's a strain to live our lives functionally and mentally, well, that's going to take away from our ability to really, live as joyfully, as wonderfully as we would like. So I always think, what is going to be the easiest to do for myself? And sometimes it doesn't feel that way at the beginning because it's new, and that's common. And a lot of times, that's why I like frequency work. And what is vibrational frequency? And what is this thing people talk about, the field and all of these things? It's really pretty simple. It's not woo, it's science, it's physics. And the idea is that everything alive, because of what it has intrinsically in its system, whether it's our bodies and our organ systems or an animal or a plant, everything moves, oscillates, moves up and down at a certain rate and quality. And I helped someone heal cancer of the mouth. How did we do that? We did not use conventional medicine. At the same time we started, they had a biopsy, needle biopsy. The needle biopsy showed the cancer cells. The client went to the head of head and neck cancer at Memorial Sloan Kettering here in New York City. Went for the investigative stuff. The guy said, I really want to do a surgery and take out samples because we can't really see here, even though it was confirmed by needle biopsy twice. I went while the person was having the surgery it was really sampling. And so the surgeon comes down because he knew I was there. And he said to me, the person was still under anesthesia. And he said, the pathologist didn't find anything. He was 2 hours, got samples. And we're going to go in and I'm going to take some more samples. And the person had agreed to this. And I don't ever tell people what to do. I support them in what they're doing, what their choices, what they feel is in their best interest. I help them know scopes of possibilities and to work at the same time as conventional is working, not against it, but with it. And so the surgeon came back down after another 2 hours. The person was out of surgery then. He said, the pathologist didn't find anything. We're going to prepare the slides. And I know that from being in Western medicine. You don't always see at those kinds of things. You have to prepare slides, look at them, in a different way. I went back with the client to the post-op, and the surgeon looks at us and he said, I don't know where it went. And in other words, there was no visible cancer anywhere. He still said, I still want to make sure that we haven't missed something. So I'm still recommending radiation. And the person, not because of me, the person decided they didn't want to do that. And it's been probably 3 years and they're fine. And who knows, they're also doing they change their diet. They are using herbal supplements. They are doing different activity. They've incorporated some of the Qigong into their life, and they have a different mindset. But, nothing's for sure. We don't know. But why not incorporate all that's possible to promote the best health and well-being that we can? It's really, and what you had mentioned before, I wanted to say something about the pharmaceutical companies. I have a real challenge with that because the pharmaceutical companies, sure, there are drugs that are life-saving, that are really helpful, that change life. But there are also drugs that make up diseases. I remember the very first time, and this was so many years ago. This was when I was still watching network television. It was a very long time ago. I don't even have it anymore. And there were commercials, and it was the first time that they allowed commercials for drugs and disease on network television. And I remember saying this to one of the people in my health center who was an acupuncturist. And I said to him, you won't believe what I just saw. I said, they made up a disease to have a drug to treat it. And now people think it's a real disease, restless leg syndrome. I mean, it's incredible. And so, I think we have to, if we want to, we have to really look inside ourselves and say, what do I think? Not what everybody's telling me. What are my questions? What do I think? And if I don't know, what do I want to find out? What do I want to look at? And some people don't, and that's okay too. Some people just want to do the prescribed treatment. Do it. I'm happy for you. But there are many people who want to know what else is possible. What else can they add to improve health and function? And those are the people I work with, because vibrational frequency is an incredible tool. Do I have something here? Oh, you know what I have here? I use things all over the place. I have tuning forks, I have stones, because stones are like pharmaceutical formulas. In fact, I was on a call today. Someone was on with my intuitive healing and health, whatever I'm calling it. And, I move energy. I teach them how to move it for themselves, and they feel better, and crazy things happen. And so I give people walk away things to do for themselves, whether it's a stone formula, which usually has at least 3 things, And this one was in amethyst, a rose quartz. And I have a big rose quartz here that I love. I keep it right here. Isn't
Oh,
that
it's
beautiful?
beautiful.
Yeah, I love this one. And this a rose quartz is a harmonizer because we think of it, it's like, what are all of the silicon chips? What are they? It's quartz. They're transducers. They bring things together and allow them to work. And so in a gemstone formula, we used amethyst, which was the principal stone, which treats heart and things like that. We used the rose quartz because she had those two and she liked them. So I'm always going to go with what is attuned for someone. And then I suggested she added one more thing, which was a bloodstone, which is a jasper stone that has a lot of movement in it and moves blood. And so those three things together create more than each one separately. And what is it creating? It's emitting because of what's in this stone. There is a certain vibrational frequency that is in here, just like we have vibrational frequencies that different things. And how do our pharmaceuticals work? The same way. How does a pharmaceutical formula, and rarely is it one item, usually it's a formula. How does it know where to go in the body? Because there's recognition of a frequency. It's because otherwise, where would it, if something is to treat, say, heart, high blood pressure is a common thing that gets treated. And by the way, you can do a lot with acupressure, tapping, and other things, not to not deal with the urgent matter. At the same time, do the other things, let your primary care or your cardiologist know what you're doing. And usually they go, because they don't have any idea. But you can not stop or not, if there's an urgent situation, do everything that you are instructed to do to keep you alive. And then when you are in a comfortable state, think, how could I improve my health? What else can I do? And then you bring other things in, because color. Today I said to someone, I said, what's your favorite color? She said indigo. And it was so interesting because what is indigo is purple, red, blue, it's a dark kind of color. And what were we talking about? We were talking about she had a leak in her basement. She was feeling unsupported and she really didn't know where to go. And what is that about? That's about our energy of the kidney bladder. That's our powerhouse. That's our life force. And what frequency color is associated with that is dark blue, black, or the bladder light blue, but she was more into the kidney portion. So how fitting that because we know if we listen inside, and that's why I love the breath and the movement of the breath and all that, because it's really learning the language of us. No one says, what's your language? Like, go inside your body and listen, deep listening. And that's also because a lot of people are challenged by stillness.
Absolutely. Absolutely. I think it's a downfall of humanity is that we don't know how to be in the void of nothing. We have to be busy.
Well, I think it comes from safety, because when we're overeating, when we're overthinking, when we're moving without thoughtfulness, we're creating a like a soup of constant movement and activity. And oftentimes that creates a sense of safety for people because they don't have to think about what is bubbling up in their innards, in their spirit, in their soul. And, there are very simple things to do for that too. I used to always say to even my dental patients, I would say, because I was And that's how I ended up going to acupuncture school, because people were asking me for so many things that the cosmetic dentistry and the other dentistry I was doing, I mean, of course, did not address. And so, I felt like I wanted to have more tools to help my patients live their lives in a joyful way. And so, doing something as simple as, if you hold up your hand, like, I'll stand up and show you this. If you hold up your hand, let's see, from your wrist crease to your elbow crease and go like this, well, this part of the part where your pinky is, this corresponds to the heart meridian in Chinese medicine. So you're stimulating the heart channel. The middle, in between the two tendons here, is the pericardium, which is the sac around the heart. And that sac prevents all the lumps and bumps of life from going all the way into the heart, because the heart is our most sacred organ. The last thing after, when people pass and transition, the last thing to go is not the breath, it's the heart. The breath stops and then the heart. And then the one where our thumb is the lung. So that's about releasing. And so this is a lovely way to create ease. I've used it many times to help me fall asleep. It's very useful. And I'll do it in multiples of 9, because 9 is a very Taoist number. There are like many different numerology ways and ways people think about things. And in Taoist philosophy and medicine, 9 is indicative of completion. So it's a very magical number in all of this stuff. So I do multiples of 9, because I think when we use things that have thousands of years old resonance behind them, we're not just doing it on our own, we're incorporating all of this magic that has been in the ages and bringing it to ourselves. And that's why I know you and I work with mentors and invest heavily. And the reason we do is because it's less, we don't have to do everything ourselves for the length of time. We can hop into someone's cultivation and frequency. That's why some of the mentors I have, I feel like the movement is so quick. And when people work with me, it's like the changes are like, it's a miracle to me as well. So, all of these things, and color, sound, odor, emotion, they all have unique frequencies. So if we want to change something that is not working in our bodies or minds, well, we identify what it is, and then and there are ways to know this. There's 5-phase theory, which it's not human design, but it's one of the Taoist ways in Chinese medicine. That's a very simple correspondence theory where you can pick and choose different things to move frequencies. And so you pick a frequency that's going to disrupt the status quo. And when you do, and that's what I think happened with the person who had cancer, we disrupted the status quo. It's like, buildings going up in cities all over the world. You see the outer structure. And then inside we put the rooms and the utilities, and then the people and everything else. But that outer framework, if it's not intact, will not enable the inner parts to be held. So if we have something in our bodies that is not working for our greatest benefit, well, let's disrupt it with a frequency, as crazy as that sounds.
What does
And
that look
that's
like?
science. What does it look like?
When you said with the frequency, for someone who's listening going, huh? Like, what does that look like?
Okay, so here's a very simple thing. If you have sadness, heart pain, anxiety, depression. And I'm not talking about clinical depression. I'm not talking about severe issues. There are many, you need to, not need to, but I would say it's desirable to really bring in the conventional wisdom. And then if you're able to add to it, this is for the run of the mill. God, I'm feeling so anxious, or I just so down. I just don't feel, and that's why moving helps. What is moving? We're adding a vibrational frequency. Sometimes it's as simple as bringing your arms all the way out to the side, lifting your head back and going, I receive my life, and then doing something like this and using the back of your other hand on your opposite side kidney, and that's a qigong move. And you're saying, kidneys, come and give me strength. Lungs, release what I don't need. Or rose oil in the heart center is so elevating. Or just put it under your nose. Or put it on a tissue and keep it close to you, or use a diffuser for oils, or those are vibrational frequencies that change things. I will say something about rose oil, though, because I always tell my clients about this. If you are practicing birth control or not, rose oil will increase sperm production. So if you start using rose oil and you don't want to conceive, make sure you're doing something about that. And if you do, then amp it up. And you can also put it like in the middle and on this side here, and those are very safe, self-limiting points. And and sounds. I mean, there are the way I came up with posture up and added the tongue position to it was when I was doing a master class on the 6 healing sounds in Taoist medicine and philosophy. And what did they find? Because we're like a musical instrument. We know that because people sing, they feel differently. We hear music, we feel differently. We know that you can go to one of the premium channels, Spotify, Pandora, whatever, and go to a 741 hertz, and all of a sudden you're kind of blissing out. And it's so simple now. That's how you use vibrational frequency to change state.
Mm. Can this is fascinating to me, although I have been so aware of it and exploring it for years. And I also know that there are so many people that this is new for them and they're thinking, what do you mean? Like, why am I asking my lung to release something? It's, my lung is there to help me breathe. And the way that you're speaking about how the body functions is really beautiful and important. And I really wanted to draw a bit more attention to that too, to help people understand the depths of what it is that you do.
Well, my idea is that I think of us like a family sitting at a table, and maybe we think of each organ system or each our digestive system. We think of our breathing. We think of our uh, elimination, both through the urination and poop. We think of our ability to feel love, our ability to regulate our heart rhythm. All of these things are like a family. And if we're having a lot of physical symptoms or mental emotional symptoms, then all of these areas, say you have 5 people sitting at a table. You have the heart people, you have the breathing people, you have the life force people, our energy, the ability that we have to move. We have what else? We have the people that move things. Let's see, what else is there? Um, Oh, did I say digestion?
I don't think so.
Maybe. No, so digestion. So we have basically 5 categories of people sitting at a table. And if the body is not working where one thing is moving smoothly and the other is saying, "Oh yeah, I know how to do that. I can do that." Instead, it's like cacophony. You have everybody shouting. It's like a family that's really dysfunctional. One person is saying, "I want it this way," and the other person's going, "No, I want it that way. No, I'm more important. No, I have this." When we incorporate frequency medicine into our physical and mental emotional being, we're creating a symphony of ourselves because we are like a musical instrument. If you imagine like say something big like a big bass, it has a big opening. It's like a big violin that sits on the floor and you're plucking strings, but there's a big opening and things go into it because of the strings that you're making sounds with. And that's what we are. If we make sounds or we create movement through vibrational frequency, whether it's color, sound, odor, emotion, those things will impact all of our organ systems, all of our mental, emotional feelings. And that's how we can augment our conventional medicine. That's how we can enhance it. And over time, perhaps not need as much medication. Never choose that on your own. Always use your conventional Western medical people as your allies. They're there to help you, whether they know how to do it or not. They probably don't know about a lot of these things, and that's okay. That's not their area of expertise. You can bring them in as partners. You can say, "I really want you to be my ally. I'd like to learn how to, in addition to what we're doing, create a system where my body is going to naturally do more of what we're asking it to do with medicine. And thank you for keeping track of me." I did that with my eye. I mean, the ophthalmology oncologist I use now, when I did a lot of due diligence. I went to a number of very important people in the field, and it's a very small field, the situation I had. In the world, he told me there are only 500 physicians in the entire world who do that work, and that's very small. And so he said to me, "You're killing yourself by not doing this." And he didn't do it because he was a bad person. He didn't do it because he was wanting to say, "I know and you don't." He did it because he thought it was vision sparing and life saving. And yet I had to do what I had to do. And so I wouldn't necessarily suggest that for anybody else. However, partnering with your caregivers and your conventional Western medical people is a really interesting way. It's like the way I like to look at the world. It's like instead of walking down the street being angry at everybody, I just kind of smile. I kind of go, "Oh, what's here for me?" And that's how we can really create a world of more harmony and more kindness and more love, both for ourselves and for everybody else.
It's the world that we need as well. There's so much chaos at the moment. There's so much chaos in the world, and there's also so much disconnect amongst ourselves from ourselves. And I value this conversation so much because it really is about bringing people back to themselves. It's about bringing women back to like their holistic wholeness, and that they're not just a meat suit. There's so much more involved. There's so much more depth, but there are so many more pathways and opportunities to reconnect, to heal, to remember, to experience life on so many different and new levels, because it's just these conversations are not had as often as I would like them to be had. Hopefully in the coming years it's more spoken about. But these practices are not really known. A lot of people would be listening going, I've never heard of any of these things. None of it makes any sense. And a lot of people would have these sorts of conversations with their physicians, and they would look at them like, you're crazy. And it's like, well, no, I'm not crazy. You just don't know it. You're not aware of it. Um, I even had an instance, which it's like a side thing, but just to show you how disconnected a lot of our physicians are from what's available. When I was going through my second pregnancy, I went to my doctor at the time and I said, I need a referral for a private midwife. And she was like, what do you mean? I'm like, well, I'm choosing not to go through the hospital system. I need a referral for a private midwife. She's like, they do that? They have private midwives? And I'm like, what do you mean? Like, what do you mean? How do you not know this? Like, you're a GP. You deal with pregnant women all the time. You're in the medical field. Private midwives are not like a new thing. Like, they've been around for a really long time. And it just blew me away that she was so disconnected. And so I know that a lot of women will have these sorts of confrontations with their medical professionals on the conversations that you've been having. But what I do appreciate is that you've actually given them language to use when they do go and speak to their profession, the medical professionals, to say, I really want you on board. And also I'm wanting to explore these options. So I thought that was lovely as well. But in terms of women really building out their team in order to support their health, are there any other areas that they need to consider? So yes, we can go and speak to our doctors. And yes, we have beautiful women like you and other people who have dedicated their lives to understanding these practices. Is there anything else that women can or should be doing to really come back home to themselves in their fullest capacity?
I really have to say, I think the most important thing is to be kind to ourselves, to have this no matter, and when there are times we all say something. I mean, we're human. I fully believe that if we had nothing to learn, we wouldn't be here. And so whatever is going on, give yourself, and this is funny, this really has gotten me through so many things. And it's funny because I happen to love dogs. I don't have a dog. New York is filled with dogs. I mean, I'm known by my friends as the dog whisperer. They actually stop in the street because they know I love them. It's so bizarre. And so I think giving ourselves that space, I call it the pause, but I think of it as PAWS, and I bring my hands up like this, like a dog, because it makes me laugh. So it lightens up things, and it gives the space for us to not feel we have to move in that direction in the moment. If we don't know where we want to go, then don't go until you know, unless it's life or death, and then you make a choice and go with it. And if it's not one that works in the moment, you'll choose something else. But the most important thing is to have love and kindness for ourselves. That's where everything comes from. That's why I am the way I am, because I finally let go of all the BS, all the, of course, do I still hear things that I heard as a child that were not life affirming? And sometimes they sound like they're in my own voice, but now when they pass through, I don't follow them. I notice them and I almost like smile because I remember, and this moves me. It's like, yes, you did this. You created this space for yourself to become who you are in this moment. And we can all give that to ourselves in every moment. And as we listen to the language of us, That's really, I would say, the most important thing. It's not any one thing. It's really having the agency, the respect, creating pleasure for ourselves. I'm very big on pleasure practices, whether it's genital, whether it's full body, whether it's like Melanie looking at a snowflake. It doesn't matter what it is. It's just allowing us to have this space for ourselves to be okay. It doesn't even have to be extraordinary. It's like, can this moment just be okay? Can I not be clenched in this moment?
There's something so beautiful about the simplicity of it. And it's something I know women don't appreciate enough. They don't even know that it's a thing that they can do. We're so busy being busy that I love this invitation for women to pause and find pleasure, how big or how small it is. And when you came on the call, you mentioned and you got emotional saying that you wish that you had these sorts of conversations, or that when you were younger, you knew this. And so I'm wanting to know, for everyone listening and for young Joan, what is it that you want her to know now that you know it?
Exactly what I just said, that no matter what, just it's okay. You are amazing. Whoever you are, however you are, whatever your functionality is, whatever your challenges are, that you are worthy of love, kindness, and becoming the fullness of your soul expression. And that's really all it is. All these other things are just modalities to help you along the way. The truth is, as I have used all of this frequency medicine, it becomes that I don't really need any of it. They're they're tools to get us to the place where frequency becomes, oh, I feel this, my partner said this. He doesn't understand what I'm talking about. I'm kind of pissed off. I'm this, I'm that. And then I go, oh, where do I want to be now? It's okay. Where do I want to be in this moment? And just choose that moment where you want to be. And it's as simple as that. And it takes a while to get there. So, in that becoming, it's so lovely to have the tools. And it's my honor to really help people learn how to choose what's aligned for them, what feels comfortable. Not everybody likes to use gemstones. Not everybody likes to do certain movements. Not everybody likes essential oil smells. But what do you resonate with? And then we use that to help you open yourself like a flower. We are like flowers. We move, we groove, we expand, we go from here to there in all different ways. And that's what it was so linear when I grew up. And I grew up, I mean, I was a child of the 50s. I was born in 51, so it's a long time ago. And I've seen many, many changes. And I've had many experiences. I've had 2 marriages, I've had partnerships. I've been very athletic as an adult. I've done crazy things, things that even when I think of now and I look at the pictures, are like, okay, Joe, like whitewater kayaking and, just kind of crazy travels and, just, and yet I regret nothing because I got here with all of that, because somewhere deep inside, and we all have that. It may be buried inside us so subtly. It's like the observer in us. It's that never ages, that never changes, but there's that little spark that somehow knows that, okay, things are really bad now, maybe, but there's that spark of possibility. And when we nurture that, and that's how I've always looked at health, I never look to find the dis-ease. In fact, I just said this to a client yesterday. I said, she was in my office. I said, and she's in medicine herself. I said, what we're doing here is we're fostering the health. We're not looking for the disease. We're emboldening the health because we all have disease in our bodies. We all have cancer cells in our bodies. We all have everything. It's what we promote. And when we get into the deep, deep listening of internally ourselves, and that's a practice, and that's the stillness, that's the you're okay, I love you kind of thing. Louise Hay years ago, I don't know if you ever heard of her. She was an incredible, I saw her in person. I went to a workshop in New York with her, with my mother and two very close friends. And she was really my first mentor in personal development. And I remember her hack, and I've told this to people a million times. You look in the mirror in the morning and you look deeply into your own eyes and you say, I love you. I really love you. And what often will happen is people will say to me when I suggest it, they go, oh, I can't do that. I can't say that. Or they go, I looked and I can't really make eye contact with myself. And so it's a practice. Just, there are all these things. And so, yeah, I could talk with you forever, Samantha.
Honestly, honestly, I'm like, we've been going for a while and I feel like we've just scratched the surface. I'm like, I have so many more questions, and we may need to do a part two because I want to respect your time as well as the listeners. And you just are a wealth of knowledge. But for those of us who have tuned in and we're like, I want to know more of Joan and how can she help me? How can women find you? How can they work with you?
Well, I will, in the show notes, you can post my website, and Linktree has links of what my current programs are. I work with people one-on-one. I love doing, I don't know when this will broadcast, but I have an upcoming program that's going to be a 6-week mini mind where we talk, I do activations because when I work with people, whether it's one-on-one or in groups, I have this facility that I have found over the years that just helps move energy in people's bodies and minds, and it clears a lot of the clutter. And so once you feel that, you can never unfeel it. So it gives you a sense of how to go back into that place that we were talking about of stillness. In fact, I did a call today with someone, and she said to me, intuitive healing and wellness call. And she said to me, and she's been in a few of my things, but not any one-on-one things. She said, I really never understood what you did, but oh, I feel so different. And everything, her color changed. And at the end of it, I said to her, I said, because really, there are so many times I say things and I think, if someone had told me this, I would not believe it. I would go, yeah, right. Yeah, this is BS. Somebody's making this up to get blah, blah, blah. It's like these things come to me. I said to her, I don't know why, but I see these little like flitting angels kissing you with these little wings all over. And I said, who was that called in Peter Pan? And she goes, oh, it's Tinkerbell. She goes, you know what? That's my nickname. It was like we both went, you know. So it's and it's not that I am that unique. It's that I have developed these over time. I believe we all have this. I believe we are all healing in every minute of every day because that is the nature of our human form and mind and soul. And so these are just adjunctive things. And so if anybody is interested in knowing more, in feeling more, in this whole topic just is of interest, book one of these simple calls with me and you'll see what it's about, because you don't have to know anything and nothing weird is going to happen. You'll just feel better.
I love that. What a beautiful invitation to just get on a call with Joan and have a special session where you don't have to know anything. There's no pressure. You just show up and then you'll feel better. And then from that place, you'll be able to make different choices and perceive things differently, which is so powerful. So I love the invitation. Thank you, Dr. Joan, so much for saying
Well,
yes to
thank
this
you.
call.
Yeah. Well, thank you, Samantha, for having me. I just really have been enjoying your energy. Really lovely, clear energy. Beautiful.
Thank you so much. That means so much. And I look forward to everyone receiving this and potentially doing a part 2 because there's so much more to be said. But thank you so much for today.
All right. Thank you so much. Take care and have a good evening or morning wherever you are in the world.
That's it. Thank you for being here, gorgeous woman, for rising with us, remembering with us, and refusing to shrink inside a world that benefits from your silence. If this episode moved you, cracked you open, or reminded you of who the hell you are becoming, share it with a woman who is ready to rise too. I want to invite you to follow, subscribe, and leave a rating so this message becomes too loud, too wild, and too undeniable to be ignored. The movement grows because of women like you. Women who choose truth over comfort, liberation over obedience, and voice over disappearance. You can connect with me, Samantha Sanford, at Rebel Matriarch, and all links to our guest are in the show notes below. Until next time, stay rooted, stay rebellious, and remember, the world changes when women refuse to disappear.